From the Benton Tower Studio, this is Fox 8 Morning Edition at 6 a.m.
Smoking leads to several health complications, and one in particular case, it leads to the fourth leading cause of death in America. And joining us right now with more on how you can prevent this chronic obstructive pulmonary disease, People's Health Dr. Angela McLean joins us. Angela, good morning to you.
Good morning.
One of the most frightening things I would think a human being could ever experience is the shortness and the loss of breath. Let's talk about this disease and the dangers and some of the things that our viewers have to be aware of.
Well, COPD is a very, very common lung disease. The biggest trigger there, unfortunately, is smoking. And what's really frustrating is that even if you're not a smoker, secondhand smoke is definitely one of the causes in individuals. So if they have a family member who's a smoker, if they're in a workplace where there are smokers, they're definitely at risk for COPD.
So you have to take a lot of preventive measures. You have to avoid certain environments and certain habits. How does one go about doing that when you consider the air, the environment, and the places you go in and out of? Well,
the biggest trigger is actually smoking. There are some other toxins and air toxins that can do that, but normally much younger individuals will know, and it's a lot easier to avoid that. You know, if they work in chemical plants or if they're in research and there's particular chemicals that they can be exposed to, then that's a lot easier to avoid.
And of course, one of the problems with youngsters that smoke, of course, they feel everybody thinks they're Superman or Superwomen. Is this is a gradual, long-term build-up to this disease? Is that how it works? It's not something that, ooh, all of a sudden I have it, is it?
Well, COPD actually, there's three major processes. One is chronic bronchitis, another is emphysema, and another is asthma. And a lot of those symptoms really actually overlap. When we traditionally talk about COPD, we think more of the chronic bronchitis and emphysema. So there are a lot of, usually much older patients, but patients who are younger, who may start off with asthma, they pick up smoking, and then it turns to more of that sort of chronic bronchitis or some of the destruction in the lung spaces that you get with emphysema, and then they can develop those symptoms as well.
Now, if they knock off the smoking over the course of a few years, the lungs can replenish themselves.
Exactly. Particularly, you'll see the biggest changes in those who have the chronic bronchitis. So chronic cough, and they may produce mucus and a lot of sputum, and so you can see the changes in that a little bit more. Once you start having some destruction in the air spaces, particularly with those who are emphysema, it can be a bigger problem.
Treatments available. What do they do?
Lots of treatments. Actually, the ones that we most commonly see are patients who use inhalers. And there's a lot of different delivery systems for the medications. There's the traditional inhaler, that's a little pump that you use. There's also these little discus as well, and they're actually coming up with more and more delivery devices just so that it's a little bit more environment friendly.
And that becomes a steady treatment over the course of time. Where can they find out more? We have about 30 seconds. Where can we find out more? Well, there's going to be a seminar tomorrow with People's Health on COPD. And I think that's at the Lindy Boggs Center. And they'll have a lot of information there. On the website there's information, and also with LSU. And quickly in closing, the best advice you can give someone to avoid this is? Don't smoke. Just don't smoke, right? Don't smoke at all. Thank you. Thank you for stopping by. Good information and very, very important.